Hi, everyone. Welcome to today's LACNETS webinar, Navigating Health and Disability Insurance, with the CEO of Triage Cancer, Joanna Morales. I'm Lindsay Judavine, the Director of Communications for LACNETS.
And I'm Lisa Yen. I'm the Program Director for LACNETS.
Before we get started, I'd like to take a second to thank Rich at TVP Live for making today's webinar and high-quality production possible. We'd also like to thank our supporters, Ipsen, Advanced Accelerator Applications, and Novartis. We'll be having a live Q&A following today's presentation. So to submit your non-case specific questions for today's speaker, go to www.slido.com and enter event code LACNETS10. While we do our best, we will get to as many questions as possible, but unfortunately, it's not possible to get to all the questions. Feel free to reach out to us or submit your questions again at a future program. Also, here are a few tech tips for today's webinar. For your audio, be sure the volume on your computer is turned all the way up. Double check that your volume is unmuted on the webinar broadcast screen. And for video, you can enlarge the webinar broadcast screen by clicking the expand screen button in the bottom right corner. Also, as a reminder, the full webinar video will be posted on our YouTube channel shortly after the live broadcast. And if you haven't checked out the LACNETS YouTube channel yet, our channel consists of a video library of 100+ net videos. Our channel features presentations on a wide range of net topics not covered in today's webinar. Also, be sure you're following LACNETS on social media to stay up to date on upcoming webinars and net news. We're on Facebook, Twitter, and Instagram with the handle @LACNETS. Before I pass it off to Lisa, I'd like to remind our viewers that these webinars are done for educational purposes only and do not substitute for medical advice. Please talk to your medical team if you have any questions or concerns about your individual care or treatment. We all have our own opinions, and these are our own opinions. They do not necessarily represent the opinions of LACNETS. And now I'll pass it off to you, Lisa.
Thanks, Lindsay. LACNETS is a program by GeneratePossibility.org, a registered nonprofit, and stands for the Los Angeles Carcinoid Neuroendocrine Tumor Society. Our mission is to provide education, advocacy, and support for all people impacted by this rare disease that used to be known as carcinoid, an old term meaning cancer-like. The more accurate term is neuroendocrine tumor, or NET for short. You'll often hear us say neuroendocrine cancer, not only because it's a patient-friendly way to say neuroendocrine neoplasm, but also because we understand NET is a type of cancer and not cancer-like or benign as previously thought. While you often see Lindsay and I leading the meetings and programs, we are led by a team which includes our interim administrator and board member Kavya Belakabuti and board member Donna Gavin, who's also the sister of LACNETS founder and executive director emeritus Giovanna Joyce Mbasi. Our board also includes Mary Dunleavy, who is living and thriving with NETs for the past 16 years. Many of you have told us about your frustrations with living with a rare disease. Perhaps you were misdiagnosed for many years while living with symptoms that brought you to your doctor's office or the emergency department several times. Or maybe you live hundreds of miles from a major medical center with NET experts and you wish you had doctors and nurses at your local clinic and hospital who understand NET. We understand many of us live with barriers like these, or perhaps other challenges I haven't mentioned, and so we wanted to empower our community to be part of that solution. I know that for me, as my husband and I fight his NET disease together, there are times where I feel helpless or feel like things are outside of my control. Well, here is something you can control. You can make an impact by joining in our NET Cancer Day 3-month challenge. So over the next 3 months, we invite you to join us. You may be someone living with the disease, or you may be an ally, a loved one of someone living with disease. We've created informational packages that you can bring or send to healthcare professionals to help spread awareness and equip them with helpful resources. There are resources for the healthcare professional and resources for the patients. So join us by telling 2 healthcare professionals about NET. It can be any healthcare professional, a local physician, nurse, nurse practitioner, physician assistant, medical assistant, radiology technician, etc. The goal is to spread awareness and equip them with practical information and support that they need. In doing so, you might help someone else get diagnosed earlier or help someone already living with NET find the support they need. So please join us in the NET Cancer Day 3-month challenge. And I'll let Lindsay explain how to complete the challenge.
Thanks, Lisa. So to complete the challenge, you must follow these 4 simple steps. Step 1, take the pledge by clicking the Take the Pledge button on the challenge page. The link is listed below, lacnets.org/challenge. Step 2, download the Ask Me About NETS information packet, which is included on the challenge page as well. Step 3, your choice to personally deliver, mail, or email the Ask Me About NETS information packet to at least 2 of your local healthcare professionals. And the last step, be sure to do this, complete the challenge form on the challenge page to confirm you have completed steps 1 and 2 and 3. So that is the 4 simple steps. We hope you take the challenge and take the pledge with us. And now back to you, Lisa.
Thanks, Lindsay. The response so far has been overwhelming. Many of you have completed the challenge, so we invite you to join us. Please share with us your pictures of the creative ways you're doing this, and together we can make an impact. I'm pleased to introduce now today's speaker, Joanna Morales. Joanna has served the cancer community as a cancer rights advocate, attorney, speaker, author, and nonprofit professional for more than 26 years at Triage Cancer, as director of the Cancer Legal Resource Center, and as adjunct professor at Loyola Law School, teaching cancer rights law. She has many publications and received numerous awards and recognitions for her service, and she is very busy with multiple speaking engagements a week. For me, one notable recognition and connection is that our founder and executive director emeritus, Giovanna Joyce Mbesi, knew Joanna and thought very highly of her. I remember when I attended an in-person Triage Cancer education seminar a few years ago before the pandemic, and I raved to Giovanna about how richly informative and helpful it was. Giovanna spoke very highly of Joanna, and I still remember that. Since then, I've dreamed of inviting Joanna to speak to our community, and so we're thrilled to see this dream come to fruition today. We are very fortunate that Joanna was able to join us today, so let's give her a warm welcome.
Thank you, Lisa. Well, I'm very happy to be with you today to talk a little bit about navigating health and disability insurance. And my goal is to give you an overview of some of the key things that we think are most important for people to understand. But I want to start by telling you a little bit about Triage Cancer so you know where to go for more information about the programs and services that we offer and the topics I'm going to talk about today. So for those of you who are not familiar, Triage Cancer is a national nonprofit organization that provides education on all of the legal and practical issues that come up as a result of a cancer diagnosis. And we do that through providing free educational events, both in person and online. We have a monthly webinar series that is free to participate. And then we also have online educational materials and resources in lots of different formats. So we have a series of animated videos, we have recorded webinars, we have our cancerfinances.org tool, and lots of additional information and resources for you to help navigate these topics. So unfortunately, our healthcare system is incredibly complicated, and there isn't a class in high school on health insurance, even though most of us actually need to understand health insurance in order to get access to healthcare. Unfortunately, only 4% of Americans could actually define the key terms that are used in health insurance coverage. And so that's a problem in terms of understanding how to navigate insurance. Also, only 40% of Americans said that they were very confident that they could actually choose the right health insurance coverage for them. And so if you feel like you don't understand your health insurance coverage, you're absolutely not alone. And so we're going to go over some of the key terms to help you understand how to actually navigate your coverage and pick the best plan for you. So there are costs that we pay just to have health insurance coverage, and it's typically paid monthly, and it's called our premium. It's what we pay each month to have coverage, even if we got no medical care during the year. But then there are costs that we pay when we go and get certain types of care. And the first is our annual deductible. It's a fixed dollar amount that we pay first before our health insurance coverage even kicks in. So you might have a $500 deductible, or you could have a $7,000 deductible, depending on the type of plan that you have. And then there's something called a copayment. And this is also a fixed dollar amount that you pay when you get certain types of care. So maybe you have a $20 copayment to see your doctor, or you might have a $50 copayment when you go and see a specialist, or you could have a $250 copayment if you go into the emergency room. And that's different from coinsurance or cost share. Those are two terms that mean the same thing, and it's a percentage. It's the difference between what insurance companies pay for our medical expenses and what we pay for our medical expenses. So if you have an 80-20 cost share, the insurance company is going to pay for 80% and you're responsible for 20%. And then probably the term that's most important for people to understand about their health insurance coverage is their out-of-pocket maximum. This is a fixed dollar amount that when you reach that fixed dollar amount in your out-of-pocket expenses, your insurance will kick in at 100% for the rest of the year. So the way that you reach your out-of-pocket maximum is actually a math problem. You get to add up what you pay for your deductible, plus any co-payments that you make during the year, plus any co-insurance amounts that you pay during the year to help you reach that out-of-pocket maximum. And again, when you do, your insurance will kick in at 100% for the rest of the year. So you might have a $1,000 out-of-pocket maximum, or you could have a $15,000 out-of-pocket maximum, depending on the plan that you have. So to give you an example of how an out-of-pocket maximum actually works, Dan has a plan that has a $2,000 deductible. It's an 80-20 plan and an $8,000 out-of-pocket maximum. And he has spent a week in the hospital, and he walks out with a $102,000 hospital bill. So assuming he's had no other medical expenses during the year, how much does he actually have to pay of that hospital bill? So first he's going to pay his $2,000 deductible, which leaves $100,000 left of that bill. But he has an 80-20 plan. So the insurance company is going to pay 80%, and he's responsible for 20%, which still leaves him with $20,000. But how much does he actually have to pay of that $20,000? Well, he has an $8,000 out-of-pocket maximum, and he's already paid $2,000 of his deductible. So he only has to spend another $6,000 out of pocket, and then he'll reach his $8,000 out-of-pocket maximum. So then the insurance will kick in and pick up the rest of that $20,000 bill. So I'm absolutely not suggesting that $8,000 isn't a lot of money, but it's better than the $20,000 if there wasn't an out-of-pocket maximum that he would have had to pay for his bill. So again, this is just an example of how out-of-pocket maximums work. And everything I just mentioned is actually in one of our animated videos on health insurance basics, in case you'd like to see it again. So there are some key consumer protections that exist in the health insurance arena that have had a significant impact on the cancer community specifically. And the first is that the Affordable Care Act eliminated lifetime and annual limits on benefits. So prior to the ACA, we would often see individuals with a $75,000 annual limit, or even a $1 million lifetime limit on a policy. Those aren't hard numbers to reach when we're talking about the cost of cancer care. And so people would effectively be left uninsured for the rest of the year or the rest of their life, and they couldn't go buy a new policy because they had a pre-existing medical condition. So the ACA eliminated those lifetime and annual limits on essential health benefits. The ACA also said that insurance companies can't cancel your policy when you try to use it. And I know that sounds silly, but at the time that the ACA was passed, that many people who were filing expensive claims for care like cancer care were finding that their insurance companies were trying to cancel their policy instead of paying for those claims. And that's no longer allowed under the ACA. So as long as you don't commit fraud on the application, then the insurance company can't cancel your policy. And then the ACA acknowledged that young adults are chronically uninsured or underinsured. So now they're allowed to stay on their parents' health insurance plan until they turn 26. So you no longer have to be a full-time student or a dependent under IRS standards. It's just based on age. Even if that young adult is married, if they're under the age of 26, they can still stay on their parents' plan. The ACA also gave us access to free preventive services. And by free, I mean you don't pay a copayment, you don't pay a deductible, and you don't pay a coinsurance amount when you go and get certain types of services. And they're things that you would generally expect in an annual checkup. So cholesterol, diabetes, blood pressure screenings, cancer screenings, flu shots, immunizations, those are all considered preventive services and have zero out-of-pocket cost to the patient to help people get access to those preventive services. The ACA also made it less expensive for patients to participate in a clinical trial. So the ACA required private insurance plans to cover the routine costs when you're participating in a clinical trial. And those routine costs are things that are routine, that would have been included in the standard of care if that's what you were getting instead of being in the clinical trial. So things like office visits and blood work and imaging scans, those are all considered routine costs, and your insurance company has to cover those costs. Now, when we're talking about Medicaid, the federal government left it up to states to decide if their state program was going to cover routine costs. But beginning on January 1st of 2022, all state Medicaid programs will have to cover the routine costs. This protection also exists in Medicare and TRICARE military plans and veterans plans as well. They just exist under different protections. And so we've included some information here on how to access those protections. The other consumer protection that's had a big impact on the cancer community is the creation of the external appeals process. When an insurance company denies coverage for a procedure or surgery or treatment or prescription drug, you don't have to take no for an answer. You can actually appeal that decision. And you can do that inside the insurance company in what's called an internal appeal. But if the insurance company still says no, you now have the right to go outside of the insurance company to an independent review organization and explain why the care that your healthcare team has prescribed is medically necessary. So that's the key legal language. And if that independent review organization decides that it's medically necessary, that decision is binding on the insurance company and they have to cover your care. So the external appeals process that was created under the ACA applies to individual and employer-sponsored plans, so private insurance. And it's incredibly beneficial because what we've seen over the time that it's been in effect is about 50% of the time, those review organizations are ruling on behalf of patients. So patients are getting their care covered about 50% of the time if they go through the external appeals process. Now, unfortunately, I call this the best kept secret of our healthcare system because very few people understand that it exists and often take no for an answer. And you don't have to believe me, there's plenty of data that shows this problem. So in 2019, just in plans sold through the marketplace, 40 million claims were denied. But only 0.2% of those 40 million claims were actually appealed in the internal appeals process. So they didn't even get to the external appeals process. So when you think about 50% of the time insurance companies are getting it wrong, that's 20 million claims that likely would have been covered by the insurance company if someone had gone through the appeals process. So what that means is 20 million people either didn't get access to the care that their healthcare team prescribed because they couldn't afford to pay for it out of pocket, or they paid for it out of pocket when their insurance company should have covered it. And so because we see this as such a huge problem and a contributor to the financial burden of a cancer diagnosis, we have a huge number of resources around the appeals process. including a module on cancerfinances.org, which explains the appeals process based on the type of health insurance coverage that you might have, whether it's private insurance or Medicare or Medicaid. So the last two consumer protections that I want to mention are actually the most important in terms of the cancer community. And so the first is about changing the way that health insurance companies can decide how much to charge us for our health insurance coverage. And that process is called premium rating. So previously, insurance companies could look at whatever they wanted to when deciding how much to charge us for a plan. And now they can only look at four things: whether or not you're buying a policy for an individual or a family, because if you're covering more people, they can charge you more; where you live based on your zip code; your age, but they put a cap on how much more you can get charged as you get older; and whether or not you use tobacco. If you use tobacco products, you can actually be charged more for your health insurance coverage. So what's missing from this list? Definitely pre-existing conditions and any of your health history, but also gender. And women have always been charged more than men for their health insurance coverage, and that's no longer allowed under the ACA. And then the ACA went a step further and said, we're not going to let insurance companies deny you health insurance coverage based on your age, your gender, your pre-existing conditions, or really any other reason. If you can afford the plan, they have to sell it to you. And so these two things together mean that an individual diagnosed with cancer can't be denied health insurance coverage and can't be charged more because of it. And that was really game-changing in the way that health insurance coverage is sold in the United States, and a huge benefit to the cancer community specifically. Now, in the United States, there's only 3 places where we get our health insurance coverage. We're either getting it directly from an insurance company, we're getting it through the government, and by that I mean Medicare, Medicaid, military and veterans plans, or state or local programs. But still about 50% of people in the United States get their health insurance coverage through an employer. It is incredibly important for people to understand all of their health insurance options. So you might know about one option, but it's important for you to know about all of your options so that you can actually compare those options and pick the best option for you. We do have a great number of resources at triagecancer.org on how to understand your health insurance options, including 2 recent webinars that we did in September and October specific to Medicare and understanding health insurance going into the open enrollment season. But looking at employer-sponsored health insurance coverage specifically for a minute, COBRA is the federal law that allows employees to keep their employer-sponsored health insurance coverage for a certain period of time. And it only applies to employers with 20 or more employees or to state or local governments. Federal employees actually have access to this benefit, but it's under a different law. So the benefit to COBRA is that you get to keep the same health insurance coverage you had when you're employed. The downside to COBRA is you're responsible for the full amount of premium that your employer was paying for your health insurance coverage. And I often say that we don't appreciate what our employers pay for our health insurance until we have to write that check ourselves. Now, if you work for a smaller employer, there are state COBRA laws that are vastly different based on where you live. So some provide additional coverage for 3 months and some go all the way up to 36 months. Like in California. So to understand your options for COBRA, you can find that information on our chart of state laws. Now, Medicare is one of the 2 major federal health insurance programs that is specifically available to individuals who are 65 years and older, or who have been receiving Social Security disability insurance for 2 full years, or for anyone who has end-stage renal disease or ALS. And Medicare.gov is the federal website that provides information on Medicare benefits, what the costs are, how to find plans where you live, and it's actually a very useful source of information. But Medicare coverage is actually broken up into 4 different parts. And when you go to make a decision about how you access Medicare, you have 2 different lanes that you can drive down. So your first option is to actually pick Original Medicare. And we call it Original Medicare because it's all there was when Medicare was signed into law in 1965. And it includes Part A, which covers hospitalization, and Part B, which covers your medical insurance. So it's really the core of coverage that covers things like outpatient care and visits to your doctor and durable medical equipment and blood tests and imaging scans. So it's the heart of the Medicare coverage. And then Part D is prescription drug coverage. So you can also choose a Part D plan that is sold by a private insurance company. And then you can decide if you want a supplemental Medicare plan called a Medigap plan, which pays for some of the out-of-pocket expenses that Original Medicare doesn't cover. So you can choose a Medigap plan sold again by a private insurance company. So that's lane one. Lane two is a Medicare Advantage plan or a Part C plan, where you're getting your benefits under Part A and Part B in a managed care plan. So you're going to a private insurance company to purchase this coverage. And about 90% of these plans actually include prescription drug coverage. But if you pick a plan that didn't, you'd also have to pick up a Part D plan. If you choose to drive down this lane, you actually don't get access to a Medigap plan. So that's where your options end. Now, every single year during Medicare open enrollment, which starts October 15th every year, you can choose to drive back and forth between these lanes. And you can be strategic about which lane you're driving through to lower your out-of-pocket costs based on your specific treatment. So we do have a huge number of resources specific to Medicare as well, including 4 new animated videos that we just released to help you figure out your best Medicare options. We also have a recorded webinar and a number of quick guides to help you navigate your Medicare coverage. Now, Medicaid is the other federal health insurance program that is available, well, prior to January 1st of 2014, it was only available to individuals who had a low income, a low resource level, meaning your assets, and you met some other category of eligibility. So there were these different doors into the Medicaid program. And most of the time, someone in the cancer community could only get into the door on the left, meaning that you went to the Social Security Administration, you applied for Supplemental Security Income, or SSI, because you're unable to work due to your medical condition. And if they approved you, then you could get access to Medicaid. So that was a lot of hoops for people to jump through. So the Affordable Care Act actually created a new door into the Medicaid program with less hoops. So it's for anyone with a household income up to 138% of the federal poverty level, which this year for an individual is $17,774. It doesn't take into account your resources. It's just looking at your income. So if you make under that annual amount, then you can get access to Medicaid. Now, the old doors still exist. The ACA just created that new door into the program. But the ACA made it mandatory for every state to create that new door. Unfortunately, the Supreme Court decision made it voluntary for states to participate in this option. So this is what it looks like today. The states on the left have chosen to expand access to coverage. The states on the right have chosen not to. And they represent about 2 to 4 million people who would have gotten access to coverage, but haven't yet. So the ACA also created the state health insurance marketplaces. And these marketplaces are effectively insurance shopping malls. It's one place where you can go to find all of your private health insurance options based on where you live. There's a lot of confusion about the marketplaces, though, and a lot of people think on our triangle of coverage that it's actually government-sponsored coverage, and it's not. It's buying coverage from a private insurance company. But there are some actual benefits to buying coverage through the marketplace. And the first is that there are consumer protections available, including a cap on the out-of-pocket maximum for all the plans sold in the marketplace. So this year, an out-of-pocket maximum can't be higher than $8,550 for an individual. There is also financial assistance to help you buy a plan in the marketplace through premium tax credits, which lower your monthly premium for whichever plan you choose based on your household income. There are also cost-sharing subsidies, and these subsidies lower what you pay for your co-payments, your co-insurance amounts, and your deductibles once you actually have a plan. I mentioned there's a lot of confusion about the marketplace, but there's also just a lack of knowledge about the marketplace. Many people don't realize what it actually does or that they would be eligible for coverage and eligible for financial assistance. Last year, about a third of all people who are uninsured could have actually gotten a marketplace plan for a $0 monthly premium based on their income level, but they didn't because they didn't know that that was available to them. So this is what it looks like based on income level if you're in a state that expanded Medicaid like California. And California calls their Medicaid program Medi-Cal, and every state has a different name for their Medicaid program. So if you have a household income up to 138% of the federal poverty level, you have access to Medicaid. If you're between 138 and 250% of the federal poverty level, you have access both to the premium tax credits and the cost-sharing subsidies. And if you're between 250 and 400% of the federal poverty level, you just have access to the premium tax credits. So all of that to say is that if you have a household of four making under $104,000 a year, you're getting access to some type of financial assistance to buy a plan in the marketplace. Now, if you're in a state that didn't expand Medicaid, you lose access to that Medicaid option, and the cost-sharing subsidies drop down to 100%. But that's not all that helpful because it's the premium tax credits that actually help you buy the plan. The cost-sharing subsidies just discount your out-of-pocket expenses once you have the plan. But there is some late-breaking news about the marketplace and financial assistance. So the American Rescue Plan Act, which was passed in March of 2021, added financial assistance to help people get coverage through the marketplace as a result of the pandemic. And you'll see this column here in the center in yellow. If you have a household income between 138 and 150% of the federal poverty level, you can now find a plan in the marketplace for $10 a month or less. That is significant financial assistance to help people get access to coverage through the marketplace. So even if you've looked at plan options in the past, it's worth taking a look at what your options are now because you might qualify for this additional financial assistance. Also, if you have a household income over 400% of the federal poverty level, there's also financial assistance available to you to reduce your insurance monthly premiums so that they would be less than 8.5% of your household income. So it also provided additional financial assistance based on your actual health insurance costs. Unfortunately, both of these two new benefits only exist through December 31st of 2022. Congress is currently debating right now, as we speak, whether or not to extend this financial assistance beyond the end of next year. So we'll see what happens. Now, then the question becomes, well, when do you enroll in health insurance coverage? Medicaid applications are accepted year-round. Medicare, as I mentioned, has an annual open enrollment period between October 15th and December 7th every year. Employer plans also have open enrollment periods, but the time period is going to vary based on that employer, but often may occur in the fall if their plan begins on January 1st. And for the 2022 marketplace plans, open enrollment begins November 1st of 2021 and will last until January 15th of 2022. But if your state runs a state marketplace, the end date for open enrollment might be different. So it might vary between December 15th of 2021 and January 31st of 2022. So you can find that information on triagecancer.org specifically. But even if you were to sign up for a marketplace plan on November 1st, your coverage won't actually begin until January 1st of 2022 because they're calendar year plans. And you can go to healthcare.gov, which is the federal marketplace website, or you can go directly to your state marketplace's website. But if you started at healthcare.gov and you're in a state that has a state-run marketplace, you'll be kicked to that website immediately. You can also apply on the phone or by mail or fax as well. And there are people locally trained to help you through the enrollment process. And you can find local assisters at healthcare.gov. Now, we know that life doesn't just happen during open enrollment. There are things that happen throughout the year that create special enrollment periods into the marketplace. And it's similar to the events that occur when you're eligible for COBRA. So if you move, or if you have a life-changing event, like you have gotten married or divorced or had a child, those are all events that give you 60 days to enroll in coverage in a marketplace plan. So that special enrollment period could happen anytime during the year. So now, if you lose employer-sponsored health insurance coverage, you actually have some options. You get to pick which lane you want to drive down. And the first is that you could look at COBRA or state COBRA. You could also look to see if you have a marketplace special enrollment period that's available to you. Then you could see if maybe there's another group plan that's available to you. So could you move to a spouse's plan? Or maybe if you're under the age of 26, you could actually move to a parent's plan if those employer plans had a special enrollment period. And then you could also see if you were eligible for Medicaid or Medicare. So there are more options than existed before the Affordable Care Act if you're losing health insurance coverage at work. But you do have to pick a lane and stick with it. If you pick COBRA and you get a few months into your COBRA coverage and you feel like it's too expensive to keep paying for that COBRA coverage, you can't move to a marketplace plan unless it's during the open enrollment period for the marketplace. So once you pick a lane, you often have to stay in that lane. You don't get to change lanes. We do have some resources to help you navigate the options if you're losing coverage at work, including an animated video and our quick guide. Now, we think that one of the most effective ways to avoid financial burden is by having adequate health insurance coverage. So I'm going to walk you through an exercise to help you make choices between your health insurance options. But if you were to go to the marketplace to see the options available to you, you could start at healthcare.gov. But if you go to healthcare.gov/C-plans, you would actually go directly to the page that lets you put in your age, your zip code, the number of people in your household, and your household income level. And it would show you the plans available to you where you live and show you how much financial assistance you qualify for and what those plans would actually cost you. So you don't have to create an account if you start there or add in any personal identifiable information. So the exercise that I'm going to walk you through is useful if you are comparing your options in the marketplace, if you're comparing choices that your employer gives you, if you're comparing what your employer gives you to what's in the marketplace, but also if you want to compare Medicare Advantage plans as well. And here we have 3 plans where there is a bronze plan with a $173 monthly premium and a $6,000 out-of-pocket maximum, a silver plan at $271 a month with a $5,200 out-of-pocket maximum, a platinum level plan at $398 a month and an $1,150 out-of-pocket maximum. So assuming you're going to hit your out-of-pocket maximum during the year, because when we're talking about the cost of cancer care, the likelihood that you're going to do that is pretty high. How much is the plan going to actually cost you by the end of the year? Can you tell just by looking at these plans? No, you actually have to do the math. And the way that you do the math is that you take the monthly premium and you multiply it by 12, because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket maximum, because that's the most that you're going to pay out of pocket for your medical expenses during the year. And so here you actually end up saving more than $2,000 by picking the platinum plan with the more expensive monthly premium, but the lower out-of-pocket maximum. Now, it's never the same. It's always going to depend on the numbers in terms of what the monthly premiums and out-of-pocket maximums are. So sometimes the bronze level plan will be cheapest, or sometimes it will be silver or gold. The point is, you don't actually know until you do the math to figure out what the actual costs are going to be for you by the end of the year. But it's not just cost. It's also making sure that you're picking a plan that covers your doctors and your hospitals and your other providers, as well as covering any prescription drugs that you take. And so the marketplace actually gives us some tools to figure that out. You can actually put in at the beginning of the process your doctor's facilities and prescription drugs, and it will only show you the plans that are available to you that cover those things. Or you can do that at the end of the process. Once you are looking at a particular plan, you can check to see if your doctor's facilities and drugs are covered by that plan. Now, if you're in a state with a state-run marketplace, they also provide the similar functionality to be able to find this information. And certainly if you're talking to someone over the phone to apply, they can provide this information as well. We do have a lot of resources to help you pick a health insurance plan, including an animated video, which covers much of what I just shared. But we also have a brand new worksheet to help you do the math when you're comparing different plan choices. And so these are both found on our website at triagecancer.org. We also have a number of resources about health insurance generally, which you can find on our health insurance resource page, including webinars on Medicare specifically and how to choose and use your health insurance coverage. We also have a new partnership with a company called CoPatient, which is a company that reviews medical bills and negotiates with providers. And they normally charge for this service, but through a partnership with Triage Cancer, through the end of the year, which is news, they have extended a free year of membership with them to be able to get free medical bill reviewing and negotiation of payment plans with providers. So turning to employment rates for just a minute before we get to disability insurance, there's a lot of information on where you can go for your employment rights. And there are laws that we refer to as fair employment laws, which protect people against discrimination in the workplace based on their medical condition and give them access to reasonable accommodations. And so those exist at the federal level, like the Americans with Disabilities Act or the ADA, but they also exist at the state level. And so it's important to not just know what's available to you at the federal level, but also specifically where you live, because those laws might be better for you and might be more protective. There are also laws that we refer to as leave laws, which allow you to take time off of work and access job protection and maybe even health insurance protection. And again, those exist at the federal level, like the Family and Medical Leave Act or FMLA, but they also exist at the state level and sometimes even at the county or city level as well. And then sometimes we work under an employment contract, and that contract can give us additional information about what we have access to at work. We may also work under a union bargaining agreement, and that agreement can provide us with additional information. And we often forget that the law just provides the bare minimum of what employers have to do, where we know that many employers go way above and beyond what the law requires, where they might be providing you with additional benefits. And those benefits could include insurance, like health insurance, dental, or vision. It might also be access to a life insurance policy or disability insurance policy. Your employer policies are also going to give you information about your ability to take time off work. In most cities and states across the country, if an employer is providing you with sick time, it's not because they're required to under the law. It's because that's a policy they chose to provide. So do you have access to sick time or vacation time or just general paid time off? Could your coworkers donate their hours to you to be able to take time off work? All of these things are going to be specific to your employer. And so looking for that information in some version of an employee handbook or manual or some type of policies and procedures document is very important. If you work for a smaller employer and don't have an HR department or you don't have a copy of that employee manual, you can ask questions of your employer to find out what you do have access to. And if you're not sure who to start with, you could start with a supervisor or maybe the person you turn in your timesheets to, or even the person who handles the health insurance for the company. We do have a number of resources on employment to understand your protections in the employment arena and how it interacts with disability insurance. Now, disability insurance is insurance that replaces your wages if you are unable to work due to a medical condition. And there are different types of disability insurance. So there are private disability insurance options that you can buy directly from an insurance company. But you can also get access to disability insurance as an employee benefit through your employer. And I can't tell you the number of people over the years that have said to me, oh, I don't have that. And I sent them back to their employee manual. And it turns out that they do have disability insurance. And it was just a piece of paper that they signed on their first day of work, and then they forgot all about it. So it's definitely worth double checking to see if you have disability insurance through your employer. And that disability insurance could be short-term or long-term. Short-term disability plans are typically 6 months to a year long, whereas long-term disability plans are typically for medical conditions that are expected to last at least a year or longer. And then there are a handful of states that provide state disability insurance. And when I mean a handful, I just mean 5 and Puerto Rico. So California, New York, New Jersey, Rhode Island, and Hawaii all offer state disability benefits that you actually pay into that system for. So through your payroll taxes, you're participating in this system. And we've included some information here about California's state disability program. But if you live in another state, you can find details about all of the state programs in our quick guide to state disability insurance or on our state resources page. And then that brings us to the 2 federal long-term disability insurance programs. And they're both run through the Social Security Administration. And the first is Social Security Disability Insurance, which is SSDI. And then there's Supplemental Security Income, which is SSI. And both of these long-term disability programs have the same very high standard of disability. In fact, in all the laws and programs that we talk about, it's the highest standard of disability. So it doesn't just require you to have a medical condition. That medical condition has to last at least a year or longer and keep you from doing your current job and keep you from doing really any job that you've had for the last 15 years. So it's a very high standard of disability. And what they're focused on is how your medical condition keeps you from working. Now, even though these are federal programs, and so theoretically should be the same across the country, they're administered by state-based disability determination services. And these state agencies can sometimes handle the details of the program differently. So if you hear from people in other states that they're having a different experience, don't be surprised by that. So I don't have a solution for that challenge, just want you to be aware of it, that you might be having a very different experience based on where you live. Now, one of the questions that we get asked most often about applying for Social Security disability programs is, can I apply while I'm still working? And the answer is, it depends. And the reason it depends is that this is the step-by-step sequential process that Social Security has to go through to decide if you have a disability. And what's the first question? Are you working? If you answer yes to that question, they're going to kick you out of the process. But that's not the whole question. The whole question is, are you working and earning more than $1,310 a month? If you're working under that amount, as far as Social Security is concerned, you are actually not working according to them. So each year they pick a financial threshold called the substantial gainful activity threshold, where if you're earning under that amount, you're not working according to Social Security. So you can still answer no to that question and move on to the questions about your medical condition. But the last two questions are about, can you work? And if you're currently working, it's very hard to argue that you're unable to work. So you do have a practical problem of explaining why it is that you could work today, but maybe you're not going to be able to work in a week or 2 weeks or a month. So you have to explain why it is that that's the case. And when you apply for disability benefits, this is all the information that you need to include. And it includes your medical records. So we often talk about disclosure and privacy of medical information in the context of work. But this is really the opposite situation, where you want to provide as much information as possible about your medical condition to the Social Security Administration to help them make their decision. And sometimes I think patients downplay their side effects when they're talking to their healthcare team. So it's important that you're communicating your side effects and all of the physical and mental and emotional impacts of your cancer diagnosis to them, so that they're documenting that information in your medical records if you're going to be applying for disability benefits, so that the Social Security Administration can see all of that information. Unfortunately, the application process does take a long time because the Social Security Administration is horribly backlogged. But in 2008, they created a new program called Compassionate Allowances that speeds up the application process. And there's approximately 60 cancer diagnoses on this list, as well as many other medical conditions. Even if you have a medical condition that is on this list, they're still going to look to see if you're able to work, and it doesn't eliminate the 5-month waiting period for SSDI. Now, SSI and SSDI do have differences. SSI is only available to individuals who have a low income level, a low resource level, again, meaning your assets, and that you have a disability that keeps you from being able to work. What someone gets each month from SSI, who is in the same category, is the same. So the maximum federal amount in 2021 is $794 a month. Now, some states add supplemental payments, but even California, which has one of the highest payments, you're only getting $954.72 a month in California. So we're not talking about a huge amount of money. But because the application process can take a while, SSI will pay back payments back to the date of your application if they decided that your disability began either on your date of application or before. So they make up for those months that it takes for your application to be approved. And for someone who does get approved for SSI, in most states, you automatically qualify for Medicaid as well. So SSI is tied to Medicaid. Even in the 9 states that don't automatically give you Medicaid, you have to go through some additional application steps, but you're likely to qualify for Medicaid in those states as well. Now, SSDI is not based on your income level. It's based on your work history and you paying into the Social Security retirement system as you've worked over your lifetime. But you also have to have worked recently. So effectively, you have to have worked at least 5 of the last 10 years in order to be able to qualify for SSDI. And what you get each month from SSDI this year is capped at $3,148 a month. What you actually get from SSDI is proportional to what you've earned over your lifetime. So if you've earned $50,000 a year, you're going to get less in SSDI each month than if you worked and earned $5 million a year. But even if you worked $5 million a year, you still only can get $3,148 a month this year. SSDI also has a 5-month waiting period where you have to wait 5 full months before you become eligible for cash benefits. but SSDI does pay back payments to the date of application, and it also pays retroactive payments, where if they decide that your disability began before your application, they'll go back up to 12 months backwards to see when your disability began and give you up to 12 months of retroactive payments as well. And where SSI is tied to Medicaid, SSDI is tied to Medicare. So you do have to wait 2 full years before you get access to Medicare. So you have to receive SSDI benefits for full 2 years before your Medicare coverage will kick in. So I will mention that over the last couple of years, there have been bills introduced in Congress to eliminate the 5-month waiting period and the Medicare waiting period for SSDI. So if you're interested in cancer advocacy, that might be a topic that is interesting to you. So then the question becomes, what do you do if you have that 5-month waiting period before your SSDI benefits kick in? And there are some limited options. So if your income is low enough to qualify you for SSI and your asset level is low enough, then you can apply for SSI and SSDI together at the same time. And then when you get approved, you start receiving SSI right away. And then you receive that for the 5 months while you're waiting for your first SSDI check. For most people, when you get your SSDI check, the amount is going to kick you out of eligibility for SSI because your income will then be too high. But in some cases, if your SSDI check is low enough each month, you can actually get SSI and keep SSDI together moving forward. If you live in a state that has state disability insurance, you can apply for that right away. And that will carry you through not just the 5-month waiting period, but you could also be receiving those benefits during the application period for SSDI. And then if you have access to a private short-term or long-term disability policy, usually those benefits start as soon as you start to take time off work. And so that can also carry you through the waiting period for SSDI to kick in. Unfortunately, in addition to the application process being challenging and taking a while, about 65% of applications are actually denied initially. So it is very important that you go through the appeals process for your disability benefits with the Social Security Administration. And there's 4 levels to the appeals process. The first is called a request for reconsideration. And some locations actually just skip that step entirely and go straight to an administrative law judge hearing. And these hearings are not like courtroom television dramas. It is the judge and a vocational expert and you, and if you brought someone to represent you. And so it's the judge that actually asks the questions. So the judge is going to ask you about how your medical condition is impacting your ability to work. And you'll have to provide the judge with that information. And ultimately, if that judge still denies your benefits, you could appeal up to an appeals council or even file a lawsuit in federal court. But generally, the administrative law judge hearing is where you're most likely to be able to communicate how your medical condition is impacting your ability to work and get your access to your benefits. If you are going to hire someone to represent you, you don't have to do that to apply for disability benefits, but it might be helpful if you're going to that administrative law judge hearing. And so if you're looking for an attorney to represent you, we do have resources to help you find legal assistance. But it's important to know that disability appeals attorneys handle cases on contingency, meaning that they don't get paid if they don't win. So if you don't get access to benefits, you don't have to pay those appeals attorneys. And what those attorneys get paid is actually based on the law. So they're allowed to charge up to 25% of your back payments, capped at $6,000. And so it's actually the Social Security Administration that pays the attorney directly out of your back payments, and then you get the rest. A lot of people have questions about whether SSDI benefits are taxed, and the answer is dependent on your household income. And so this is what the chart looks like. You can find this information on Social Security's website, but you might have to pay federal taxes if your household income level is higher. You also need to look to see whether or not your state requires you to pay taxes. If you're getting SSI, those benefits are not taxed. And then people have questions about what happens if you're receiving SSDI and then you reach your full retirement age. And the answer is nothing. Nothing happens. The Social Security Administration just stops treating them as disability benefits and continues to treat them as retirement benefits moving forward. And for most people, the amount stays exactly the same that you're getting each month. And then sometimes people are concerned that once you've received benefits, that Social Security is going to review your medical condition and take them away at some point in the future. And that process is called reviewing a medical condition. And so they're only going to review your medical condition based on a specific time frame. So if you have a medical condition where improvement is expected, they're going to review your medical condition 6 to 18 months after they approve your benefits. If improvement is possible, they're going to review you every 3 years. And if improvement is not expected, they're going to review every 5 to 7 years. But I already mentioned that Social Security is incredibly backlogged, and so the time frame doesn't always happen this way. But even if Social Security decides that you're no longer eligible for benefits, you can still appeal that decision using the same appeals process that I just mentioned. And then sometimes people actually want to try to go back to work while they're on disability benefits. And the Social Security Administration has a number of programs called work incentives to help people go back to work, either part-time or full-time. They even have a trial return to work period where you can try to work and continue to receive your benefits and the health insurance coverage that is tied to your benefits, and also receive income. And so all of that information is included on the Social Security website and on our website at triagecancer.org. So we do have a number of resources to help you navigate disability insurance, regardless of the type of insurance that you might have, including a recorded webinar and a module on cancerfinances.org on disability insurance. So cancerfinances.org, I just want to tell you about in a little more detail. This is a website that you can go to that provides information on topics that can impact your financial situation. So you can learn about these topics and then be connected to financial assistance resources. But what is unique about this site is that the people can actually answer questions as you go along, and it tailors the information based on how you've answered those questions so that you're getting the information that's most relevant to you. And then if you still need assistance with your personal situation, you can contact our legal and financial navigation program, where you can get one-on-one assistance on topics like navigating health insurance or employment issues or disability benefits or finances or estate planning or any of the other legal and financial issues that come up after a cancer diagnosis. So you can contact that program by filling out an online form at triagecancer.org/get help. So with that, I'm actually going to turn it over to Lisa and we will take some questions.
That was a very helpful presentation, and there's a lot jam-packed in there. And thanks for mentioning all the exciting resources too. I know there's so much more that you could probably cover, and I know that your resources are really excellent. So I know that your website is listed on our LACNETS resource page as well, and we definitely encourage people to check it out. So let's get to some of our questions. There's several that have come in, and we'll start with a simple one. What documentation do we need to save from the insurance or Medicare carriers, and for how long?
That's a great question. So anytime you're getting communication from an insurance company or from a provider, you want to make sure that you're not ignoring that communication. You definitely want to make sure you're opening your mail to see what's coming. And when we're talking about medical bills, you always want to compare your medical bills to the explanation of benefits from the insurance company to make sure they match. And if there are any discrepancies, that you're asking questions about what those discrepancies are and what you're actually responsible for paying for. But once you've done that, how long you actually hold on to those bills is somewhat up to you. I generally recommend keeping them for at least a year till the end of your plan year for that insurance plan year. But those medical expenses that you're paying for could potentially be tax deductible. So if you're keeping records for your taxes in terms of the medical and dental expenses that you're paying out of pocket for the year, you might actually want to keep those tax records for 7 years, which is what the IRS recommends, because they have the potential to audit you going back 7 years.
Mm-hmm. And you mentioned reviewing the documentation to see if there's a discrepancy. How long do you have to appeal that or clarify?
That does depend on the insurance company. It's generally 1 to 2 years. So anytime you come across a problem with a bill or you've been denied coverage, you want to make sure that you're following the timelines laid out by your insurance coverage to appeal. And that could depend based on the type of coverage that you have.
Great. Thank you for that. Of course, there was a lot of talk on disability, so there's questions on it. What are the pros and cons of personal disability, and how do you go about applying?
So if you are buying an individual disability insurance policy, most people don't do that. We don't proactively buy disability insurance in the United States the way that we might do health insurance or even dental or vision or life insurance. And once you have a pre-existing medical condition, it's more difficult to buy a private disability insurance policy because the pre-existing condition protections that exist in health insurance don't exist in disability insurance. And so if you already have a pre-existing medical condition, chances are you can't go and buy one. It's very difficult to find those policies or carriers that will offer them. So that's why it's beneficial to take a look to see if that's an employee benefit that an employer might offer you if you're looking for a new job.
Okay, thank you for that. And I'm not sure what type of disability this addresses, but are there disability plans that do not require medical exams?
Well, to my previous point, I think that most disability insurance companies require you to provide medical information. Maybe not full medical records, but they might be asking questions like, have you ever had cancer? And they're allowed to ask for those questions and have you go through the medical underwriting process to see if they're going to insure you.
Thanks for that. And does someone living with NET, so neuroendocrine tumor, neuroendocrine cancer, qualify for disability, specifically long-term disability? And then how do you go about applying? I know you talked about what needs to go into the application, but how does one get to that application?
So it depends on what type of disability first we're talking about. So first, whether or not someone with a neuroendocrine tumor qualifies for disability is going to be individual to that person. And so that's why they look at not just whether or not you have the medical condition, but how it's impacting your ability to work. So I'll give you an example in another context. So we know that 1/3 of all women with metastatic breast cancer actually continue working, even though metastatic breast cancer is a medical condition that makes you presumptively eligible for disability benefits. So just having the medical condition isn't enough to decide whether or not you qualify. They're still going to look to see how your medical condition and the side effects you're experiencing impact your ability to work. So in terms of applying, it's going to depend. So if you have an employer policy, You can start with your employer and go directly to the insurance company that your employer offers. If you have an individual plan, you're going to contact that individual disability insurance company to apply. If you're in a state that has state disability insurance, you're going to go to the agency that handles state disability insurance. So, for example, in California, that's the Employment Development Department. And then if you're looking to apply for the federal long-term disability programs, you're going to go to the Social Security Administration. And their phone number is 800-772-1213. And their website is ssa.gov.
ssa.gov. Thank you for that. And I'm sure that information is on your website as well.
It is.
Okay. So this is an interesting question as well. Does a surviving spouse get the deceased spousal disability benefits, particularly for someone who hasn't worked enough in the last 10 years to get their own?
So spousal benefits are a little bit more complicated and depend on the details of a situation. So that could be something that you contact our legal and financial navigation program, and we can figure that out for you based on your specific situation. But you might also be eligible for retirement benefits based on your spouse as well. And so you might want to take a look at that too.
Okay, that's helpful that you have the navigation program as well. Let's shift a little bit to some of the Medicare and insurance policies. Can you have Medicare and some form of ACA marketplace policy together?
Generally, no. So if you are eligible for Medicare, you are not eligible for a marketplace plan. There might be some circumstances where you're transitioning off of SSDI and had Medicare, where you're no longer eligible for parts of Medicare. You can pick up a marketplace plan to supplement coverage. So that's a very nuanced situation. But generally, if you're over the age of 65 and eligible for Medicare, you can't get a marketplace plan.
Okay, well, that's helpful. And there's, of course, a few questions about specific treatments, and I know it's probably depends on the plan, but this particular person says they're on a Novartis copay assist program. Does it continue into Medicare and or an Advantage Plus private program like that offered now by SAG-AFTRA?
So I'm guessing that an Advantage Plus private program is a Medicare Advantage plan. And regardless of how you're getting access to Medicare, generally, once you become eligible for Medicare, you actually don't qualify for the copay assistance programs that pharmaceutical companies provide if you have private insurance or if you're uninsured. So those are actual federal rules around the pharmaceutical companies not being able to provide that type of financial assistance if you're on Medicare. So those are federal rules that they have to comply with. But there might be other types of financial assistance that those companies might be able to provide, depending on your circumstances, or there might be private financial assistance resources that exist outside of the pharmaceutical company. And so I definitely recommend that you take a look at those. On cancerfinances.org, we have a prescription drug assistance module that lists all of the pharmaceutical companies and the program contact information based on specific drugs. And we also have the other financial assistance programs that are available to help with the cost of prescription medications.
Thank you for that. That cancerfinance.org sounds like an excellent resource.
We try.
Yeah, so here's another similar one. So, and lanreotide is another medication that is very common. So this person has Blue Cross Medicare Advantage, and their plan makes them pay a lot for lanreotide. How do we find the right insurance to cover cancer drug treatments?
So if you have a Medicare Advantage plan, so if you think back to my description about driving down two different lanes, if that Medicare Advantage plan includes prescription drug coverage, then you might want to look at moving your Advantage plan to another plan that either provides prescription drug coverage or doesn't, and then you have to look for a new Part D plan in addition to your Advantage plan. anytime you're comparing any of those options, you can look to see if it covers your particular drugs. And one of the simplest ways to do that is to actually go to Medicare.gov and look at your plan options based on your zip code and put in the drugs that you take, and it will show you the plans that actually cover those drugs and what the out-of-pocket costs would be for those particular plans if you were taking that drug. So it's a little bit of homework on your part to do that plan comparison, but it's going to give you that information. You can also contact 800 Medicare and talk to a human being on the phone who can actually tell you which plans cover those drugs. And then you can also contact a resource called SHIP, or the Senior Health Insurance Assistance Program. That is a federal program through Medicare where they give money to local organizations who are trained to help people navigate Medicare and Medicare-related decisions. So you can contact your local SHIP program who can help you figure out which plans are going to be best for you specifically. And you can find the SHIP programs at Medicare.gov. On the Contact Us page, it lists all the SHIP contact information based on geographic location.
That's a lot of really helpful resources and navigation resources. And where can we find those numbers again and the websites?
So Medicare.gov, and then if you go to the Contact Us page, you can find the contact information for the SHIP program where you live locally. And it might be called something different in each state. So in California, I've just blanked on what it's called in California. In Florida, it's called SHINE. So in each state, the initials might stand for something different, but the federal program is the State Health Insurance Assistance Program.
Okay, that's helpful. So Medicare.gov.
HICAP. It's HICAP in California.
HICAP. That's right. I remember that from one of your webinars. That's right. Thanks. So now talking about medications, does an out-of-pocket maximum also apply to drugs, especially specialty drugs?
That's a great question. So plans sold in the marketplace, the out-of-pocket maximum does include prescription drugs. Some employer plans have started to carve out prescription drugs from the out-of-pocket maximum, and they have a separate out-of-pocket maximum for prescription drugs. So that's information that you can find from your employer plan directly. But if it's a plan sold in the marketplace, it has to include all of the out-of-pocket costs, including for drugs, in the one out-of-pocket maximum. When we're talking about Medicare, that's a whole different conversation in terms of how Medicare Part D plans are structured and what the out-of-pocket costs are. There isn't actually an out-of-pocket maximum for Medicare Part D.
Okay. So I guess a follow-up question to that, if the medication is not covered then, and there's not an out-of-pocket max, then does that mean you're responsible for the whole cost of that medication?
So there's two parts to that. One is the drug covered? And even when a drug is covered, you usually have some out-of-pocket costs, whether it's a copayment or a coinsurance amount. When we're talking about an antibiotic, for example, you might only have like a $5 copayment for your drug. But if we're talking about a specialty drug, like a cancer-related drug, you might have a coinsurance. So you might have a 10% or 20% or even 30% coinsurance amount that you're paying for those drugs, which definitely increases what you're paying out of pocket for your medications. So if you are having trouble paying for your out-of-pocket costs, I highly recommend finding out if you qualify for one of the pharmaceutical copay assistance programs or the other private organizations that provide assistance with copays for drugs. So I'm not sure if that answered all of your question, Lisa.
Yeah, that's helpful. And again, that cancer finance site seems like a great place to go for that.
Yes, so cancerfinances.org.
cancerfinance.org. Okay. And, kind of, I know this wasn't the main topic of the webinar today, and you kind of touched on it a little bit. So what's the best way to go about filing an appeal for denial of coverage? Who needs to do it? Like, does it need to be the patient, and what supporting documentation or maybe scientific articles, et cetera, needs to be included?
So it is going to depend on the type of insurance coverage that you have and the timeline and rules that they've laid out for you to actually file an appeal. But generally speaking, if you want to file an appeal, you need to put it in writing and send that information back to the insurance company, usually in the form of a letter. And usually it's the patient that does it. But sometimes healthcare teams can help with the appeals process, especially if it's appealing the denial of a prior authorization, maybe a prior authorization for surgery. And so healthcare teams can be very useful in this process. They can also provide the documentation that explains why something is medically necessary. Obviously, your healthcare team recommended treatment for a reason. They know what those reasons are and the details and that you can include in your documentation and your appeal about why the care they've prescribed is medically necessary. If it's a situation where you're getting a newer treatment, maybe, or even are participating in a clinical trial, having the newest scientific research that backs up why that particular treatment is the best treatment for you can also be helpful. But that's also something your healthcare team can provide for you.
Great. And then in terms of what needs to go into that appeal, do we need to attach letters from the healthcare provider, scientific articles? What needs to be attached?
Any information that you can provide and that your healthcare team can provide to you to support your request for them to appeal the decision can be useful.
Okay, great. That's helpful. I know you mentioned for disability, you have disability attorneys. What help is available for medication or treatment appeals of coverage?
So it would be a similar process to what we've been talking about. If they have denied coverage for medication or treatment, you can appeal those decisions and provide that supporting documentation. But I would also say specifically for prescription drugs, the pharmaceutical companies that make the prescription drugs that you might be taking could be very useful resources in the appeals process. So they might have already pulled together all of that scientific evidence, or maybe it's actually a coding issue where the provider is coding the treatment or drug incorrectly and making it more likely for the insurance company to deny. So you could actually contact the pharmaceutical company to see if they have assistance with the appeals process to help get it covered.
Great. This is all very helpful. We just have a couple questions left. One is, can someone switch from HMO to PPO 1 year and then switch back the next year?
Absolutely. In fact, I recommend that every single year people check to see if their insurance is still working for them. Even if you think everything is perfect, it doesn't hurt to take a look to see what your other options are so that you're finding the plan that still covers all of your providers and your prescription drugs, but also to make sure that it's a plan that costs you the least by the end of the year and that works for you financially.
Okay. And what might be any things that they need to watch out for if they're switching back and forth?
When we're talking about private insurance, like in the marketplace or choices that an employer gives you, it's just making sure that your providers and your drugs are covered. Because if you pick a plan, even if it's the cheapest plan for you, if you pick a plan that doesn't cover those things, it's pretty useless. So you want to make sure that it actually covers what you need it to cover and still cost you less by the end of the year.
Great. Thank you. And I know you covered, SSI and SSDI. If you're under the age of 65, do you need to apply for SSI or SSDI to qualify for Medicaid or Medicare?
So if you're under the age of 65, you don't need to apply for SSI to get access to Medicaid. You can apply directly for Medicaid if you qualify to get through one of those doors into Medicaid that I mentioned. So if you're in a state that has Medicaid expansion, like California, for example, you just have to have a household income under 138% of the federal poverty level. So if you have an income level under that amount, you can get access to Medicaid if you're in a state that has Medicaid expansion. With Medicare, you can only get access to Medicare if you are over the age of 65 and eligible for Social Security retirement benefits, or you've been receiving SSDI for 2 years, or you have end-stage renal disease or ALS. Those are 2 medical conditions where you automatically qualify for Medicare.
Okay, thank you. And we'll take this as the last question. Does your organization provide assistance to individuals and then also to individuals in any state?
Yes, so Triage Cancer is a national organization, so we help people across the country, and we do have the events that we host that are free, as well as the free resources and materials. And then we also have our legal and financial navigation program where you can ask individual questions and get one-on-one assistance. So you can find that at triagecancer.org.
Thank you for that. Thank you for this really informative webinar, your presentation, all the answers to these questions, and your commitment to the cancer community and to our community as well. We really appreciate your time, your knowledge, and just empowering us with all this information.
Well, thank you so much for letting me talk with you today. It was a pleasure.
So helpful to have you. And now I'm going to send it back to Lindsay in the studio.
Thank you, Lisa. Be sure you're following LACNETS on social media. We have Facebook, Twitter, and Instagram. Stay up to date on upcoming events, webinars, and net news. As a reminder, today's webinar is being recorded and can be viewed on our YouTube channel shortly after the live broadcast. As Lisa mentioned, and I mentioned in the beginning of today's webinar, we invite you to take the pledge and join us for our Net Cancer Day 3-month challenge. To take the pledge and learn more about the challenge, go to www.lacnets.org/challenge. Before I pass it back to Lisa to close us out, I'd like to remind our viewers that these webinars are done for educational purposes only and do not substitute for medical advice. Please talk to your medical team if you have any questions or concerns about your individual care or treatment. We all have our own opinions, and these are our own opinions. They do not necessarily represent the opinions of LACNETS. And now to you, Lisa.
Thanks, Lindsay. We understand these may be challenging times, and we offer many programs and resources to help, including our weekly virtual NET support group, a dedicated caregiver-only support group that also meets virtually, a NET Vitals downloadable patient-physician communication tool to help you prepare for your medical appointments, and health coaching that's available to NET patients or caregivers. We encourage you to go to our website, www.lacnets.org, to find out more information about our programs, view resources, read blogs, take NET quizzes, and much more. LACNETS recently launched a new podcast featuring local NET experts who answer the top 10 questions in their field. We will be releasing one episode the 15th of every month. We hope you'll take a listen and let us know what you think. We have an incredible lineup of speakers for the rest of 2021. Next month, on November 10th, our Net Cancer Day Symposium will focus on patient advocacy with patient advocates Josh Mailman and Cindy Lovelace, as well as patient physician Dr. Mark Lewis. It'll be a celebration of living and thriving with the disease and what you can do to help increase awareness. We hope you'll join us. And in December, Chaplain Michael Echelon will be joining us once again to close out the year with an inspirational talk titled Riding the Cancer Wave, Spiritually Speaking. We've lined up speakers through March of 2022, including Dr. Pam Kuntz in January, who's going to speak on NET research. So what's new with NETs and what's on the horizon? And in February, Dr. Heidi Del Riviero will speak on pheochromocytoma and paraganglioma. In March, Dr. Aman Chauhan will talk directly about high-grade neuroendocrine cancers. So we hope you join us. If you registered for today's webinar, you will be receiving an email to fill out a survey. We would really appreciate it if you take the time to fill it out, as the survey results help us with our fundraising and support and planning for future events. Thank you again to our presenter, to Rich at TVP Live, and to all of you for joining us today. Goodbye, and we hope to see you next month on November 10th for our Net Cancer Day Symposium.